Hello, I'm Eileen Monison with PR Accounts. Today I'm here with Dr. John Schmidt from Belmar, New Jersey to discuss a new concept called the medical home. Hello, Dr. Schmidt.
Hello, Ms. Monison. It is a pleasure to be with you today and to discuss the important concept of medical home.
So, Dr. Schmidt, exactly what is a medical home?
A medical home is a medical practice that cares for the entire patient. As your personal physician, I will work with you to design and build your medical home.
So, why is this important?
Most patients have many physicians and caregivers who care for various aspects of their emotional and physical well-being. As your personal physician and medical home builder, I look after and manage all of your care. Think of me as a general contractor. A general contractor works with electricians, plumbers, roofers to build a home. All of the work provided by these talented specialists needs to be coordinated and managed to build a home that is built to your specifications. I will work with your medical specialist in the same way to build your medical home.
Dr. Schmidt, can you give us an example?
Yes. You as my patient may have a cardiologist, a gastroenterologist, a urologist, a gynecologist, all of whom give you regular examinations, but no one to make sure that you have the right immunizations and age-appropriate screening tests. As I build your medical home, I will identify gaps in your medical care and make sure that you have everything you need to stay healthy and well. I will manage also your personal health information so that all of your specialists have access to it when they need it.
Does a medical home take the place of working with a specialist?
Not at all. A medical home allows your specialist to focus on particular aspects of your medical care. A medical home therefore makes specialty care more successful and more efficient. The duplication of tests, as well as the risk of potentially dangerous drug interactions, are both therefore minimized. A medical home can also help you find the specialist that you need.
Dr. Schmidt, this sounds wonderful, but exactly how does it work?
Medical homes use the latest in information technology to organize the patient's personal health information into an easy-to-use and completely secure electronic medical record, or EMR. Your electronic medical record is updated after every office visit, after every lab result, after every visit with your specialists. This allows me, as your personal health physician, to anticipate problems before they occur and keep you healthy. Shown now is an example of how the electronic medical record appears on your doctor's computer screen. As you can see, it shows a general health record, your active problems and diagnoses, procedures that have been done, your vital signs, which of course include things like temperature, blood pressure, pulse, and respirations, your medications, your family medical history, the various office visits and encounters that you've had, again with either myself or your specialists, your lab results, and your allergies.
Does the patient have access to his or her own electronic medical record?
Yes. Patients can access their electronic medical record with a secure password by visiting my website, www.schmidtmd.com. This access point is called a patient portal, and it resides on a very secure website. This allows patients to see their diagnoses, their medications, their doctor's recommendations, and test results online. Patients can also ask questions and typically receive answers either the same day or by noon of the next day. There is also a to-do and tasks completed feature in the patient portal. Patients can also make appointments and request prescription refills if they so desire.
Dr. Schmidt, why is this important now?
As medicine becomes more complex and patients wish to engage more actively in their own health care, there is a real need to coordinate care, minimize redundancy, and give patients greater access to their confidential medical information, no matter where they may happen to find themselves geographically. As long as you have access to the internet, you have access to your personal physician and your personal health information. Shown on this next graphic is an example of how we keep track of the various important events in your medical life. As you can see, the record captures procedures, referrals to specialists, as well as showing when visit dates have occurred in the past, when they will occur in the future as well.
This is very interesting. What exactly attracted you to the medical home concept?
When I worked in the pharmaceutical industry searching for new cures, the importance of seamless teamwork became crystal clear to me. A medical home allows the patients, physicians, and specialists to work together as a team. As a result, you, the patient, receive a higher level of care.
Dr. Schmidt, I've heard that both Microsoft and Google have introduced websites to allow patients to assemble their medical records. Is this the same as a medical home?
Not really. These are very useful websites that help patients aggregate their personal health information, but they do not take the place of a medical home. Here is where the distinction is. A medical home not only allows you, the patient, to work with your physician to aggregate your personal health information, it also allows all of your doctors to work together under the leadership of your personal physician to keep you healthy.
You mentioned the word design earlier. How exactly do you design a medical home?
Just as every home needs a foundation, there are some elements that are common to every medical home, such as the electronic medical record and access to patient medical records via the patient portal that we discussed earlier. Other features can also be selected to customize the medical home to better satisfy the patient's individual needs.
Dr. Schmidt, can you give us an example?
Yes. Some patients may wish to have face-to-face access to their personal physician while traveling. Skype is a communication application that can be built into the patient's medical home along with other features. So if the patient is abroad and encounters a medical issue, I can Skype them to discuss it and provide clear recommendations.
How can patients find out more information?
I am happy to discuss the medical home concept with prospective patients. I offer a complimentary meeting for patients to learn more about the value of having a medical home. Appointments can be made through my website, www.schmidtmd.com, or by calling the office at 732-282-8166.